Thank you, Femi, for that kind, if naughty, introduction. Remember, the economist thinks the glass is neither half full nor half empty, but just twice as large as it needs to be. Good afternoon to everybody. It is an honor to be here today with such a distinguished panel. I want to very sincerely thank Bill Gates for being here today in such an eloquent and inspiring opening. Thank in particular the ministers who are here today to pay attention to this crucial issue. All of you for participating, and all of our partners helped produce this landmark study, which I want to speak to briefly today. Don't worry, I'm not going to give you a detailed set of spreadsheets, but we do want to cover the key messages because this is an important study that will help us on this agenda. As Femi said, now more than ever is the time to invest in nutrition because we have the urgency, we have the science, and we have the economics. The urgency stems from the fact that this century is going to put unprecedented demands on people for cognitive skills, for socio-emotional skills, for physical resilience in the face of what looks to be a very dynamic and possibly fragile century. The science is now clear and indisputable. The first 1,000 days of a child's life are the window in which we can plant the seeds for the strongest nutrition and life possible. From preconception to a second birthday is when the entire nutrition story happens. And that's when the foundation is laid, literally the foundation of the development later. The foundation of a building determines how strong, how tall, how resilient that building can be. It is precisely the same for human beings, and I would argue for economies as well. Today, we are grossly underinvesting in this. As Bill said, almost half of child deaths worldwide are attributable to undernutrition, and equally tragic for the many millions of children who survive, 1/4 of them are malnourished. 159 million children worldwide are permanently stunted, which means they're more prone to illness, they will be less able to learn, less resilient in the face of life's shocks. Their bodies and brains will just not ever grow to their full potential. So long before they ever reach the schoolhouse door for their first year, their lifetime potential has been truncated in a way that cannot be reversed. So this is why we say that nutrition is both a marker and a maker of poverty. The economics is also there. We now have strong evidence that investing in nutrition can reduce poverty dramatically if you see these numbers, 1/3 less likely to be in poverty if you are not stunted, and contribute ultimately to overall economic growth. This stands to reason just from intuition. If you are more productive, if you are more able to learn, if you are more resilient in the face of health and other shocks, you're going to be able to contribute more to the economy. But we now have a growing number of rigorous studies to back this up. And this is why at the World Bank we now consider nutrition core to achieving our twin goals of eliminating extreme poverty and boosting shared prosperity. In other words, nutrition is a pro-poor investment. It is pro-efficiency because it means that the country will get more out of its education and health investments. And it is pro-economy because this is going to help boost growth and productivity over the long run. And yet we are at the end of what seems to be an endless series of underinvestment in nutrition worldwide. Developing countries in their health budgets devote less than 1/2 of a penny of every dollar into nutrition out of their whole health budget. Overseas development aid, it's less than 1 penny per dollar that goes into nutrition. That is a shockingly inadequate number to build the foundation of what is ultimately all development. And this is not just an issue in the poorest countries. Stunting rates are high even in middle-income countries such as Guatemala, Indonesia, Nigeria, and India. But this is a problem that we can solve, otherwise we wouldn't be here today. Countries as diverse as Senegal, Peru, and Vietnam have shown us that with a concerted effort, it is possible to drive down stunting rates and relatively quickly. In 2012, the World Health Assembly adopted 6 global targets, and today we're going to focus on the 4 for which the evidence base is the strongest. And what I want to present today is, for the first time ever, we have an investment framework for nutrition that spells out both what resources we need and where they can come from. So nobody wants to watch spreadsheets on a sunny Sunday, so let me cut to the chase, give you the headline. The world now needs $7 billion additional dollars per year for the next decade to achieve the nutrition targets that were set a few years ago. $7 billion additional per decade. You can see from this, the vast majority of this is for reducing stunting. But the good news is, we know resources are scarce, times are tight, it may take some time to ramp up to this level, so we can get started now with a more modest core package. While we're gearing up, we can focus on a package of priority investments that have proven to be the most cost-effective and which can be scaled up quickly. The cost for these is just a little over $2 billion additional dollars per year. The priority package can be seen as a down payment that can get some crucial momentum going. But I want to stress, unless we make the full $7 billion additional commitment, we will not be able to achieve the global nutrition goals. So let me just break out one piece of this, the top line on stunting. If we were able to achieve this, the additional investments in nutrition-specific activities would actually help us to achieve the 40% reduction. It won't do it alone. There are other investments I'll speak about in a moment, but it will let us reach that target in a way that we otherwise could not. And again, since resources are constrained, if we had to go just with the priority package, we could still achieve a 50 million person reduction in stunting in the next few years. All right. That's enough on the cost. Let me talk about the benefits. If we could achieve all 4 targets in the next 9 years, we would avert almost 4 million child deaths per year and have 65 million fewer cases of stunting, 65 million fewer truncated futures, and stronger potential contributors to societies and economies. Even with the priority package, we would get significant returns. We would save over 2 million children's lives, and we would see 50 million fewer cases of stunting by 2025. And of course, here we're only focusing on the health and nutrition impacts. If we carry this forward into the impacts on productivity, opportunity, learning, growth, competitiveness, we feel in the World Bank this is probably the single highest return investment in all of development, the highest return. So, how can we work together to finance this? What we proposed in the paper is a global solidarity approach, which is very much in keeping with the latest thinking on financing for development. Resources are tight everywhere, and what we need now is a joined-up approach that can combine domestic resources, international partners' inputs, private and philanthropic sources to maximize our inputs and our impact. So if global partners are able to increase their investments in the next 5 years, along with domestic resources, after the 5-year point, we estimate that domestic resources can take on the lion's share of these investments, which of course is the most sustainable option. But we do need this surge financing from partners in order to help this to succeed. And I want to draw your attention to something that's hard to see, I'm sure, but the very thin bar, green and at the very top there, this represents innovative sources of financing, which we also see as crucial to this. Examples of these are the Global Financing Facility for Every Woman, Every Child, and the Power of Nutrition, both unveiled last year, in which the World Bank is a proud partner and founder. These can actually help to leverage and unlock billions of other resources in the other parts of this graph to help us achieve the levels we need of investment. All right, $7 billion a year. This seems like a lot of money, but I want to remind you, between the time you sat down today and midnight tonight, the world will invest $1 billion in agricultural subsidies in the rich countries and in fossil fuel subsidies around the world. And by lunch on Wednesday, we will have spent $7 billion on those sorts of things that are not pro-poor, that are not good for the climate. Basically, they're bad for the poor and bad for the planet and do nothing to promote the goals we have here. So this is affordable if we simply look broadly enough at where we're currently spending our money. But I have to also say, it's not just about putting more money into nutrition, it's about getting more nutrition for the money, obviously. And that means scaling up the interventions that have been the most cost-effective, and that's very much embedded in this study and how it's been put together. It also means we have to get the maximum global impact on nutrition, which is not just about nutrition-specific investments. So it's very important to continue with investments in clean water, sanitation, hygiene, girls' and women's education and empowerment, food availability and diversity, social protection, and other supportive investments. At the World Bank Group, this is why we see investments in nutrition now as an integral part of early childhood development, which also includes early stimulation and early learning programs. With the right nutrition, every baby is born with the same ability to thrive on this planet, but far too many of them do not get a fair start. Inequality is wired in from the start before they're even born, and they face lifelong disadvantages as a result through no fault of our own. As our president, Dr. Kim, said the other day, competing in today's digital economy and this world is going to call for a workforce with very well-developed brains. And we cannot expect employers to invest in countries where the workforce is not sufficiently developed physically or cognitively to take advantage of this. Simply put, countries that do not invest in nutrition are not investing in their futures, and they're harming their future prospects. So the science is there, the economics is there, the urgency is there. Why is this not happening? In all honesty, because we feel we haven't reached the right audience with this message, which is one reason we put this study together. And in a large partnership, we'll be spending this year trying to get this onto the agenda, the development agenda, the agenda of finance ministries, others in a position to make the decisions and write the checks. We know you are deluged with requests, with needs. This will save the planet. This is absolutely essential. But as you compare all these, we want you to think about two things. One is we always focus on the negatives about nutrition. If you miss the window, you can never replace it. It's a lost opportunity, et cetera. But remember, flip it over, and the positive is equally true. Once a child attains her full potential height, her full potential cognitive potential, nothing can ever take that away or reverse it. Think about how many other development investments you can make that are durable, portable, and that have life cycle impacts that extend well beyond one lifetime. These investments are forever. These investments are enduring, and they pay off for decades to come. Down the road. So this is why early childhood development now is at the top of our agenda, including stunting at the World Bank. We're going to host an event at our annual meetings this October to bring finance ministers centrally into this conversation. And we ultimately want to see a world where there is no childhood stunting, because otherwise we will never attain the development that all developing countries and the world at large is going to need. Thank you very much.